We will start the symposium today by a review of two of the first center research projects. This first one we are so proud to share with you. We launched the center in May 2nd of 2018. We already have a project in place that has IRB approval and, as Dr. Byington was mentioning, is addressing an epidemic of physician burnout and nurse burnout. So today to present on this research is Dr. Terri Menser, who is a scientist at the Center for Outcomes Research at Houston Methodist. She is also assistant member of the Houston Methodist Research Institute. She completed a postdoctoral fellowship at the Ohio State University in the Department of Family Medicine before she joined us here at Houston Methodist. She has worked on projects related to health information technology, patient engagement, implementation evaluation, and health disparities. During her studies as a PhD student, she was also research associate, evaluating the implementation of primary care into mental health care settings through the Texas 1115 Medicaid Waiver Demonstration Program. Her current research examines surgical outcomes, burnout, patient portal use, and telemedicine. Please help me welcome Dr. Terri Menser to the podium.
Thank you, everyone, for having me here today. I'm honored to be able to tell you about our first Health and Nature study. This is our team: Dr. Bita Cash, Carrie Byington, Christoph Kermonic, Dr. Patel, Farzan Sesengahar, Dominica Delgado, and Dr. Rob Phillips. It's a very multidisciplinary team for the effort that we're doing. We've titled Designing Systems to Prevent Physician and Nurse Burnout. So just a little bit about burnout. I think we all know it's an epidemic. It ranges anywhere between 30 to 70% across the healthcare workforce, depending on the measurement tool used and the study that you read. So it's something that everyone knows needs to be addressed. What we're looking at, so burnout is a combination of stress over time related to emotional exhaustion, depersonalization, and self-efficacy. We know that burnout is bad, right? People make mistakes. They're not happy at their job. We have to hire new people. Apologies. I tend to wander. I'll try not to. All right, so when you're tired, when you're unhappy, you change jobs, it costs money. These are things that we would like to be able to prevent. There's a lot of research. Schonefeld has done some research tying burnout to errors, early retirement. What I'm going to talk about today relates to Maslow and Leiter. They are basically, in terms of measurement, they're the conceptual burnout gurus. They have their own journal titled Burnout. So they actually look at misalignment between the 5 factors there, the 6 factors there on the right. So if your workload, your control, your reward, your community, your fairness, and your values, if your expectations in any one of those categories does not align with the actual, then these are the ways that we experience burnout, right? Too much of a workload or even too little of a workload. You're bored. In healthcare, it's often too much. But workload, control, reward, community, fairness, and values. These are the avenues to burnout. So our study overview, what we're doing, we're building on a study that has previously linked empathy to burnout. There's an association. Individuals who are more empathetic are more likely to be burnt out. So what we're doing is we're adding in nature. We want to understand, from a conceptual point of view, does nature make a difference? Will nature buffer people against these things that cause burnout? Can nature alleviate some of the stress in our environment? A lot of the interventions that we currently have related to burnout take extra time. This study is looking at nature to see, can we build into the environment components that would help reduce burnout, help reduce stress, without requiring of the healthcare worker or of the physician extra time. So this is an Fmri study. It's a large study for an Fmri. It's 60 individuals. We're going to be looking at residents and nurses. What we are going to do is basically induce stress, right? So we're building off of Ty's work. So we will induce stress, and then we will show visualization of nature, and the control being urban images. And I'll show you some preliminary images that we've validated. So in terms of measurement, the right-hand side, you'll see these are wandering. On the right-hand side, these are Ty's images from the original study that we're building off of that are identifying empathy's relation to burnout. And so we'll be using similar measurement. We also will be capturing and assessing burnout through the Maslow Burnout Inventory. We'll be measuring empathy through an assessment as well to be able to correlate that to the actual empathy captured through the MRI. And then the top slide, I guess, is the most important. That's where we are in the study. In order to do an Fmri study, you first have to validate images of the concepts that you're using. And in this study, we're using empathy, we're using nature, and we're using city as a control. So far where we are is almost done validating these images. Here are our top 4 nature images. Our top 4 urban images. And so prepare yourself. The empathy images do tend to evoke a little bit of feeling in our top 4 empathy images. And so these images will be put into different tracks, actually 2 different tracks, to be able to measure reactions that people have sequentially. We're doing 2 different lineups. So the impact of this study, as I said, will be that it could establish that nature has the ability to either buffer and or alleviate stress that would be felt in the environment, which would be a different type of intervention than is currently used. That's it.